Hello, everyone. I am here with Caitlin, Nikki, Tanvi, and Bianca, and we will be talking about combating vaccine hesitancy in the BIPOC communities within LA. Within this presentation, we will be starting off with some background information on addressing mistrust towards healthcare, and then afterwards, we will get into the 3 stages. So the first stage will focus on what to do during the pre-vaccination stage. Stage 2 will emphasize what is needed for the vaccination, and stage 3 will discuss what is required post-vaccination. And then later on, we will conclude with limitations in each of the stages and a thank you.
Before we presented our solution, we wanted to provide some additional background information to contextualize the issue at hand. America has a long history of racism that has bled into many of its institutions, namely the healthcare system. Looking to historical examples of racism within healthcare, such as the Tuskegee syphilis study shown in the image above, and the forced sterilization of African American women during the Jim Crow era, we are able to see why BIPOC communities may be distrustful of the healthcare system. Furthermore, looking to a more contemporary example, BIPOC communities have much higher rates of COVID-19 morbidity and mortality than their white counterparts. Lastly, another key issue we identified were the language barriers that can often prevent effective patient care.
Some numbers to showcase this. From the Oman Medical Journal, 70% of limited English proficiency patients reported limited availability of interpretive services. From the Kaiser Family Foundation, 55% of Black Americans say that they distrust the American healthcare system. And from Salud America, California's Latinx communities only make up 39.3% of the population, yet constitute 55.9% of California's positive COVID cases as of May 2021.
Looking to these statistics and historical examples, we realize that our solution must address the mistrust that the BIPOC community has towards the healthcare system before we can solve vaccine hesitancy. We hope to achieve this by focusing our solution on increased transparency and cultural sensitivity. And for further clarification, we define vaccine hesitancy as the low vaccination rates within LA's BIPOC communities as a result of this aforementioned mistrust.
Now we will go into our 3-stage solution to combat vaccine hesitancy. For the first stage of our solution, we will focus on the pre-vaccination period, which involves creating and distributing pamphlets that includes information such as a breakdown of what is in each vaccine that is presented in an accessible manner to the general public. Potential side effects of the vaccine will also be included, as well as testimonials from community members who have also received the vaccine. Community vaccination site locations will also be listed in the benefits of receiving the vaccine. In addition to this, we will also be recruiting community ambassadors from various community centers such as religious centers, parks and recreation centers, farmers markets, schools, and pharmacies. These ambassadors would serve as an intermediary throughout the entire vaccination process. They will work closely with community members to bridge the language and cultural barrier by acting as a liaison between their community and healthcare providers.
The second stage of our solution includes setting up mobile clinics in predominantly BIPOC communities throughout Los Angeles and taking these resources directly to them. This will increase vaccine accessibility to individuals who previously did not have access due to distance, transportation costs, or other variables. The community ambassadors from the previous stage will continue to serve as an intermediary, as they will be on site to bridge the communication, language, and cultural gap between healthcare workers and those receiving the vaccines in order to increase trust.
The final stage of our solution includes an automated survey that is sent by text message to individuals after they have received the vaccine. This survey will gather information regarding post-vaccination symptoms, and depending on these symptoms, the survey will give the patient information on how to counteract their side effects. The community ambassador during this time will serve to help patients set up the automated survey while also providing patients with a resource card. This resource card will list hotlines and websites that patients can use to answer frequently asked questions regarding post-vaccination symptoms and care.
We had the opportunity to speak with Jason Liang, who is a supervisor at Chinatown Service Center's Vaccine Mobile Clinic. Jason's actually a UCLA Society Genetics alumni, and he was super happy to share his experience working with medically underserved communities and getting those populations vaccinated. Chinatown's population is heavily monolingual and geriatric. They often face huge barriers to accessing healthcare and are hesitant about receiving the vaccine. His advice from working firsthand with vaccine hesitancy includes bringing these resources directly, which we incorporated into our solutions by setting up mobile clinics. Furthermore, Jason stated that translation is critical to decreasing vaccine hesitancy and that based on his experience, establishing community presence is important to foster trust. With his advice, we hope that our solutions regarding mobile clinics and community ambassadors can directly aid the communities that we're trying to serve through effective communication and empathy.
Some potential limitations we might run across along the way in stage 1 and stage 2, finding reliable and trustworthy community ambassadors, volunteers, healthcare workers, and of course, securing funding for the resources at our multiple locations and to pay these ambassadors or healthcare workers. For stage 3, digitizing all the information as it rapidly updates could be a problem. And we also want to find a way to continue to build trust after these vaccination sites within this community.
Thank you for listening to us discuss the specific topic of how to combat the vaccine hesitancy within the LA's BIPOC communities, and we hope you enjoyed.